talk. If they want it in the beginning, we do. You first, yes, and then at the end. I guess it's at the end again. That's for CTV. Oh, doesn't matter. It doesn't have to be at the end again. Can you hear him?
I can hear his voice.
That from there, right?
Coming through the wall, not through your hearsay.
Feel your thirst beside the river. Wash the journey from your hands. Feel the comfort flow inside you. Come this far, you understand. Fear's not allowed, where dreams can be lost or found.
And here we are.
Hello, welcome to Healing Outside the Box. I'm Rosemary Lachance, and I'm a Reiki energy healer and a spiritual development advisor.
And I'm Traci Crampton, and I'm an energy practitioner.
And tonight, this is our 49th show. Okay, we are dedicated to providing you with food for thought information and answers to alternative healing, spiritual development, animal welfare, nutrition, and our environment in the form of guest speakers who are experts in their field. We hope we can help you find the answers you're looking for. Please feel free to email or call us with any questions you may have. We hope you enjoy the show.
Tonight we have a returning guest, Dr. James Sensenig, for our 49th show. And the subject of tonight's show is about people telling their stories on natural cures and naturopathic medicine. But first we want to do a little bio on Dr. Sensenig. Dr. Sensenig has been practicing naturopathic medicine for nearly 30 years and is well known for helping thousands of people regain their health. Dr. Sensenig sees patients with complaints of all kinds and is particularly interested in the treatment of digestive diseases, headaches and migraines, joint and muscle complaints, and chronic fatigue. He also sees children with health problems ranging from asthma and eczema to developmental delays and autism. Dr. Sensenig graduated from the National College of Naturopathic Medicine in Portland, Oregon, where he later served as Dean of Education. He was the founding president of the American Association of Naturopathic Physicians, the chairman of its Government Affairs Committee for a decade, and the founding dean of the College of Naturopathic Medicine at the University of Bridgeport, Connecticut. Dr. Sensenig has consulted for a number of government agencies, insurance companies, colleges, and natural product companies. He is on the faculty of the Southwest College of Naturopathic Medicine in Tempe, Arizona, and the University of Bridgeport College of Naturopathic Medicine. And we're really happy to have him back
Welcome
tonight.
once again.
Thank you. Nice to be
Thanks
here
for
again.
coming back again.
My pleasure.
Okay, so tonight we're going to have people talk about their success with naturopathic medicine.
Right.
And we wanted to ask you a few questions. Why do you think that there's more success in naturopathic medicine than conventional medicine?
Well, that's a good question, and it has to do, frankly, with the way naturopathic doctors look at the body. And I think we've talked about this personally before, but in a nutshell, the conventional system of medicine tends to treat symptoms. You go in with high blood pressure, they treat the blood pressure. You walk in to a doctor, a neurologist, or someone with migraines, the medicine is directed at the migraine, the pain in the head. You have low back pain, it's the pain in the back, digestive problems, too much acid, you turn down the acid, too little acid, you turn up the acid, if that's ever recognized, and so on. Whereas in naturopathic medicine, the goal is to treat the underlying cause. Or to say it differently, the symptoms are seen as an expression of an underlying problem.
A systematic
It's a little
problem.
bit like when you have a building that's on fire and the alarm goes off. The alarm is a nuisance. It's making a lot of noise. It kind of gets in the way. And one possible way to deal with that alarm is just to turn it off.
Right.
And then the problem is solved.
Yeah.
You don't have the noise
You
in the
have the noise,
background
yeah.
and so on. But you still have a burning building.
Right.
Right?
That's a good way to put
Yeah,
it. What
it
a
is.
good example.
Conventional medicine, using that metaphor, and I'm stretching and simplifying a little bit, tends to turn off the alarm
Right.
rather than look at the burning building. And this is why you turn off the alarm. You still have, again, stretching the metaphor is a little difficult here, but if you turn off the alarm and you allow the building to keep burning, something else is going to happen. The building's going to collapse. The windows are going to blow out. The foundation's going to go.
And if you deaden people's alarm system,
Right.
where they won't even know that there's a burning building.
Well, that's a great,
It's like-
Traci, that's
That
really a
is-
great point,
that is a great
because
point.
you turn off the one signal,
Right.
and then the body, in its wisdom, tries something else. There's another signal.
Right.
Now we turn that one
Smoke.
off, right? Smoke, or whatever, if you want to stretch that metaphor.
Yeah.
Now you turn off that signal,
Yep.
and now something else happens, and so on and so forth. So you still have the burning building, and everybody in this culture knows somebody who's taking a medication for something, and then a medication for the side effects of the first one,
Right.
and then medication for the side effects of the second one. That's
Pretty soon
Kinda
they're
what we're talking
taking
about.
10,
Right.
10
Right.
pills, 12 pills a day, and that's
right, particularly in the elderly.
too
as I'm
much.
sure
And a
you
lot of
know,
times
yeah.
And it gets so confusing.
it's the side effects that make them sicker or even kill them sometimes because there's so many side effects.
Well, there's I think it's 109,000 people a year die from the side effects of their medication
Oh, boy.
when it's properly taken and properly
Wow.
prescribed. And
That's
then if you go
drastic
beyond that and you look at
numbers.
medications that are mixed wrongly or taken where there's overdoses or something, then the numbers go up. But properly prescribed medications are responsible for 109,000 deaths a year.
My
Wow.
God, that's unbelievable.
So we've had you on our show before, and you've been a wealth of information and intrigue. Right?
Yeah, he's very intriguing.
Like, very
Intrigue.
intriguing in terms of like how, what's really happening and what's being not discussed openly
He's
in
a
public.
walking encyclopedia of facts about anything to do with this kind of thing. It's amazing. It amazes me.
Yes.
Well, there's a lot going on under the radar on the one hand, and there's a lot going on that
It's very helpful.
the authorities, conventional systems, the infrastructure, it's hard to know how to talk about that exactly. But there's a lot of things that are happening in medicine that are not common knowledge
Right.
in the United States. There are many treatments for all sorts of things that are widely used in other countries which are not available in the United States for one reason or another. The reason you're often given is to protect you because it's not approved by the government. But protecting you from what might be the question.
Especially
there
when
are
a lot of, basically in order to get approved, it needs to be a chemical medical.
Well, that's an
right?
That's an interesting point. I'm not an expert
get
on
funding.
on the approval process with the FDA, but the people who are will tell you that the what I want to say, the benchmark is so high that you can't possibly meet it unless you have gazillions of dollars and truckloads of paperwork for the FDA to reach approval. And this is because, in part, in the United States, for something to be approved to treat a certain, I'm going to say, symptom, because that's the way the conventional system looks at disease. It's a symptom. It's a headache. It's low back pain. It's chronic fatigue. It's depression. For something to be approved for that symptom, it has to be safe and effective. Now, in other countries, particularly in Europe, the threshold is not safe and effective. It's safe. If something is safe, one doesn't have to rise to this higher level. And the reason for that is there are many things in common use that have been home remedies and natural remedies that cannot be patented, that cannot be owned by a particular pharmaceutical company, which are safe when they're consumed. They have no side effects. There's no danger in taking them. And they should be available to people for therapeutic purposes. That's not the case in the United States. It is the case in Europe. So there's a class of medications that are considered safe, although they may not have been proven at this higher standard to be effective, while they are proven effective through historical use.
Right.
For example, before we went on the air tonight, some of us were chatting about children with ear infections, and one of the sort of home remedy tricks that's often used is a little bit of garlic in some oil, or mullein, which is an herb, in olive oil
that works
in the
wonders.
ear.
Yes,
Okay,
yeah,
and it
my
works
children,
wonders, right?
One night and it's gone. The next morning they're fine.
And there's a perfect example. I mean, it's a low-level example. It's kind of a funny example. We're talking about putting garlic oil in your ear.
Right, if you don't mind I recommended it to a friend the other night, and I said, if you don't mind smelling like salad dressing, this works really well.
But there's an example of something that's safe and has been proven effective for treating ear infections over many hundreds of years. Right. So why not have something like that available? Now that's a very, very, again, low-level kind of example
it's
of what we're talking about.
for companies to make a profit on that.
Well, exactly. Right? So no one is able to patent or own a drug made from garlic because it's in the public domain. So a very large number of public of proven remedies that are herbal remedies or other foods or other substances which are not drugs cannot be used therapeutically because no one is going to spend the time and the money to show that it's effective. I mean, why would you spend, a gazillion dollars on proving that garlic can help an ear infection if you can't recoup the cost?
Right.
Or or for that matter, any other vitamin, mineral, or nutrient that your body needs to function properly.
Because it's a world based on profits, a world based on greed, and it's all got to do with money, 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 and it's.
But think of the profit to be made. Let's just go down that road.
Everybody's healthy and working.
Think of the profit to be made in an industry that was focused on people getting well.
Right.
And
can
keeping
show
them well.
Up for work.
What would that do, first of all, what would that do to productivity in the United States?
Right.
What would that do to creativity in the United States? You know how many people are in lousy jobs that they hate, that they go to work to every day because they need the benefits? Right? Think of what, and I'm not an advocate of getting the government involved in healthcare, but if we had a single payer system where someone had guaranteed health benefits like in many developed countries, can you imagine how many people would leave their jobs tomorrow to open that bed and breakfast or that little art studio that they want to run or whatever else they have? The creativity that would be unleashed under those circumstances with people reaching their maximum potential physically and emotionally and otherwise. Instead, we have this system that is forcing people, I almost hate to say this word, but it's almost like slave labor. You've got people forced to stay in jobs that they hate because they need the benefits, and the benefits are doing nothing to help them get well.
Right.
In fact, that's getting everybody who's watching this show knows,
more and more sick
know.
Because we all know what depression will do to you when you're in a dead-end job that you don't enjoy.
Well, and
either.
I've been in practice a little over 30 years, and I'm convinced that one of the major causes of chronic disease in this country is the healthcare system. Because I'm the guy who sees the person in the office who's crying or depressed or near violence because their healthcare insurance company won't pay for simple tests, or they won't pay for long-term care, or they won't pay for reasonable treatment for a child who's ill or something like this. And the stress that people are under in this country for or because of the finances and the cost of healthcare are incredible. It's got to be part of the. It's got to be part of the system. And I think personally, I think I can't prove this to you statistically, but I think that accelerates the demise of many patients who are terminally or chronically ill, just trying to negotiate the healthcare system. I mean, it's unbelievable. I always think, imagine a healthcare system that was actually focused on people getting well.
Yep.
Yeah, but then they wouldn't sell so many drugs. The pharmaceutical companies wouldn't sell so many drugs.
Well, then they'd all
Hospitals
have
would
to
be
get
so busy. Wouldn't be a clinic on every corner.
I know.
And a clinic in CVS.
I know people are like,
CVS
oh, they're
drugstore.
opening. They're thinking this is progress, but I think it's a sign of, lousy health in our country. When you see a pharmacy and an outpatient building go up every 2 blocks,
And a clinic in the pharmacy.
And a clinic in the pharmacy.
But see, now you come back to this philosophical issue. When you're only treating symptoms and you don't care why they're there, you can do that.
Right.
You can have a doc in a box anywhere, right? A doc in a box anywhere in the country. Because when you walk in with a strep throat, or you walk in with a headache, or you walk in with back pain, if the only treatment is that which addresses the symptom, It doesn't look at the whole situation. You don't need any time. You only need 2 minutes.
Right.
Back pain, here. Depression, here.
That's what they do.
Then you can put a doc in a box, and that's where that system is going.
Right.
And exactly that. More and more in, the corner drugstore or whatever.
Yep.
So with the purpose of the show, we're hoping that we can reach some viewers and give them some information in case they're feeling discouraged or they want to step outside the box
Right.
and try some new things. And we thought, what better way to do that than to have some people come on and share their experiences with naturopathic medicine.
And we appreciate the opportunity to do that because, as we know, it's one thing for us to sit here and talk about it, what that might look like theoretically.
Right.
But when you can hear from someone whose health has been restored or whose life has been changed by having their health return, especially if they've been on the treadmill that we're just talking about
people
one
feel
symptom
so
after
locked
another.
into the healthcare system too, like that's the only options they have. And
Well, one of the plugs I want to put in here for naturopathic medicine is naturopathic medicine, by that name, has been around in the United States for over 100 years. It was actually founded in the United States by doctors who were, and driven by the public demand, of course, doctors who were appalled at the way the medical system was not addressing the issues of underlying cause over 100 years ago. That was the impetus. This is not alternative medicine. This is not New Age medicine. This is not something that came out of the 60s. This is based on the principles that people have observed in the human body for 2,500 years or more. The kinds of underlying ideas that we bring to practice in naturopathic medicine are the things that Hippocrates wrote about before Christ. So this is nothing new. In fact, in some ways, this is the medicine of the planet, and what we call conventional medicine is way off the, in terms of the family tree.
Yeah, I've had some people mention to me, like, oh, I'm going to go the old-fashioned route, and they are referring to, their cold medicines and their ibuprofen and seeing their general practitioner. And I say, that's not the old-fashioned route. This was before that. This is well before that time.
And what I feel upset about is that a lot of insurance don't cover naturopathic doctors, and they're not allowed to practice in every state of the United States.
Yes, but you're coming from the point of view where you're assuming that healthcare insurance is for the purpose of healthcare. And that's the...
Oh, excuse me.
Right?
Oh my God, I got that all wrong. I'm
So
sorry.
that's a whole different argument. The purpose of healthcare is not for healthcare. It's to make profit for the stockholders.
Exactly.
Because if healthcare insurance were designed for healthcare, it wouldn't be designed the way it is.
Right.
And this is, this is 2009, right? You can't tell me that we don't have the brains or the brawn or the resources to design a healthcare system that would support health.
Denmark and these countries where people are actually supported in their health. They have a system where they're allowed to take long maternity leaves and have a maid come in to help them when they have children. And
I know.
Can we run with that for just 1 second?
Yeah, sure. Their system provides those
According to the
services.
World Health Organization, out of 191 nations, the United States ranks 92nd in overall health. Our healthcare system is ranked 47th in performance. The healthcare system is ranked 47th in the world. I'm not making this up. World Health Organization, you can go online, World Health Organization, look it up. The medical system is 47th in performance, but the health of the nation is 92. Now, we got all these people in Washington who are supposed to be bright. There are 91 other nations that have a better healthcare system than we have. Why don't we just look at what they're doing? Why do we have to reinvent the wheel? Why do we have to pretend that nobody else has the answers and we have to do what we're doing in Washington, which really isn't healthcare reform, by the way. It's just increased access. Increased access, by the way, to a system whose accidental death toll is 500,000 people a year. So increased access doesn't necessarily mean we're going to have better health. It might mean just the opposite.
Well, a question has come up. Do people come here from other countries for operations and so forth, as far as surgery and things like that? That question.
I think that we're all taught to believe that because we have the best of the best. But there's a rapidly growing new industry that's called medical tourism, where people are going overseas for elective procedures because the outcomes are better, the cost is cheaper. I mean, the exaggerated thing is, you go to Sweden or you go to Thailand for a bypass. or a coronary bypass, and you have a 30-day vacation, and you have your bypass, and and the whole thing costs less than what
I have a friend who goes
here in the first place.
to her native country. She calls them dental vacations. Like she goes and has dental work done. And
Okay, well,
comes back.
all right. So,
All right, well, we can get to our guest.
yeah. All right, then we have a few more questions, so maybe we'll ask them at the end. So, our first guest tonight is Monique
Bowman.
Bowman. Hello, Monique. Welcome to the show.
Thank you.
So, do you want to tell us your story? What happened to you, and what brought you to visit natural medicine, naturopathic doctors?
Yes. I have a 3-year-old son. His name is Dominic. Dr. Sensenig was actually my professor at the University of Bridgeport College of Naturopathic Medicine, teaching philosophy in my first year study there. And I decided to bring my son, who was an asthmatic at the time, to be seen at the practice by Dr. Wertkin. Since then, he's had a variety of issues: asthma, eczema, GI issues, recently an ear infection. And his response to the treatment it just reaffirms why I'm studying to become a naturopathic doctor.
Oh, you are? That's
yes,
good. Oh, look at that.
It's just amazing. It's like from his first visit, just seeing, the treatment protocol, the way the doctor interacted with him, his response to the doctor, it solidified for me what I was doing was the right thing for me. He loves Dr. Wertkin. He gets a boo-boo. He wants to go to the doctor.
Mm-hmm.
The doctor.
And
Confident.
yeah, he's very confident, and it makes me feel comfortable, and it makes things a whole lot easier for me.
Now, you say he had some eczema?
Yeah,
issues
eczema, asthma, all have since cleared up.
What did they give you per se? Just the herbs and the different naturopathic medicine?
Different things from homeopathy,
yeah.
diet changes.
Right. They talked to you about that, right? Diet changes, and
Always.
And they do testing and everything.
Yeah, in some cases, but for the eczema, there was no need. It was obvious.
Right.
The diet changes, and including things in his diet like fish oils, removing common allergens, simple things that didn't cost much of anything,
Right.
were what helped him. This is after going to a pediatrician and being told that, he would just grow out of it.
Yeah, I've heard that. Oh, he'll grow out of it.
Yeah, he'll grow out of it. And, being a mother first time especially, I didn't like to see it, and he was uncomfortable with it, so.
Why should he have to suffer?
That's what I say.
Why should he have to suffer?
That's what I say. And in no time, it was resolved. The asthma, we haven't seen asthma, thank God, knock on wood, in, I'd say, over a year now. And again, this was something we were told, just take the inhaler, keep it on you, give it to him, when you see he starts to wheeze, and I didn't want that for him, so.
Mm-hmm. Mm-hmm. Wow. And to think that he might have been dependent on that protocol for the rest of his life, and now maybe just with some dietary changes and avoiding certain things in his diet.
Exactly. Exactly. I was determined that he wasn't going to use the inhaler because, I've seen the effects of, using
I guess it's a
steroids, daily, and I've seen things, and I didn't want that for my son.
Now, was there any side effects from the natural treatment?
Absolutely none, except getting better. Like, there was nothing bad that happened except he, had a better quality of life. He looked better. He behaved better. It was funny to see, like, with the asthma and the eczema, they were, it seems like, allergic reactions, and his mood,
the behaviors.
The behaviors.
Part of that, especially with the children.
Yeah, and again, like I said, the pediatrician didn't, see that link and didn't think anything of it, and again, he would just grow out of it. So.
Yeah, see, that's good. And what I like about naturopathic medicines is doctors, they not only give you what they have, like their homeopathics and some of their herbs, but they also tell you what you can buy in a health food store to help you. They're not saying, oh, don't go buy that, use what I have to give you. They tell you to do that because they're so concerned with your well-being. That whatever it takes, that's what I love about them.
I agree. That's how I feel too. Like every time we go to the doctor with my son, I'm leaving with more than just, oh, he won't have this problem anymore. I'm educated, he's comfortable. I know that the issue is going to be taken care of and his whole person is going to be addressed, not just, okay, the asthma today or the eczema today. It's going to be, okay, here you need to be doing this for him. We have to boost his immunity. We have to change his diet. We have to, look at him as a person, not just this symptom, whatever it may be.
And I've always felt that I've been heard, like that, the physician, a naturopathic physician, has taken the time to really say, what's been this child's experience. I had a daughter. My daughter had similar issues when she was very young, and I really felt that I was heard. That what I had to say about this child's experience and what she was suffering with was being heard, fully heard. Where sometimes I feel that, and I'm not speaking for every medical physician out there of conventional means, but, it's like very quick, you're waiting and then it's in, out, and, on your way, and you're like, you're left with like all these things to say and
next.
And it's not, you never have a complete conversation about what's going on. So I'm glad you've had such success.
Me too, thank you.
That's great.
Me too.
So can they see any naturopathic doctor or alternative?
Well, that's a really good point, Rosemary. And what you just said about medical doctors as well. If you're going to be honest about it, it comes down to the doctor who understands this. From a philosophical point of view, the point of medicine and the point of medical training is to treat the symptoms. That's what allopathic medicine or conventional medicine does. However, we're living at a time when there are a growing number of medical doctors who are beginning to understand this different model or different paradigm. Now, it's a little skewed because they're coming from an older model or a different model into a new model, and it's hard to make that translation. It's like you grow up in one country and you move to another, you may always have an accent. And I think of a medical doctor as always having an accent, right? In this case, an allopathic accent. And that's a specific word that has to do with the way things are treated. But I'm also sad to say that there are many naturopathic doctors, or maybe I should say physicians trained in naturopathic schools, who are tending to go in the other direction, who tend to be a little quicker about treating symptoms. Now, they may use natural substances. They may use some of the things that Monique mentioned, but they use them as though they were drugs. They're using them in order to treat a symptom. Okay? A very common example these days is many of your viewers may know about something called red yeast rice.
Yes.
Okay, now red yeast rice functions pharmacologically like a statin. Okay, so if somebody comes to a naturopathic doctor with high cholesterol and they're offered red yeast rice instead of one of the statin drugs, that's still allopathic medicine. That's still conventional medicine. That's still treating the symptom. Even though the treatment is natural, the approach is still treating the symptom. So sad to say, you can't just go to anybody who is licensed as a naturopathic physician.
So interview
your doctor, talk to them, call them up. Many would be happy to talk to you on the phone for a few minutes, or at least their staff would, or make a short appointment and go find out who they are.
You're right. You're right. Absolutely right.
And if I can just add one quick thing, if the viewer is paying attention to what we're talking about here, you would understand the distinction that I just made on your first visit.
Right.
Like Monique just said, she was confident that the doctor was not treating the eczema or treating the asthma. The person was treating her son. Right. And if somebody was offering just something in the conventional model for eczema,
slap something on the
you
skin.
use a topical anti-inflammatory. Well, there are natural substances that can act as topical anti-inflammatories. That's still allopathic medicine, even though it's a natural anti-inflammatory. So that distinction should be very obvious to the person who's paying attention.
Wow.
Okay, good. All right.
Okay, so we got more stories to tell here.
All right, our next guest is Roberta Edwards. Hi, Roberta. Welcome to the show.
Thank you.
And tell us your story.
Okay, back in June, I decided I would go to Dr. Workin at Dr. Sensenig's office. I had a severe case of eczema, probably from head to toe. And I had it for a couple months. It slowly had progressed from April and May, and by June it was so severe I felt helpless. So knowing I've done conventional treatments before for it and it didn't work, it would come back about 3 months later after those topical ointments. I needed to try something different. So what I did was I checked my insurance, and they did cover naturopathic, and I found out who was in there, and I started doing my research. And when I came to Dr. Work and reading her bio, something came over me. I said, this is the doctor I needed to see, made the appointment, and I went in. And it was just relief from the first day that I went in there. I knew that she could help me.
Wow.
She did she did several tests on me, basically checking my immune system and had an idea of what would be causing the eczema. I had probably had one of the worst cases she had seen. And Dr. Sensenig will attest to, she brought him in to consult because it was amazing. But just leaving there the first time, I knew that eventually I would be helped with supplements and diet change and a procedure called hydrotherapy, which I did lots of. Really has made a difference in my life.
Tell us about the hydrotherapy.
Hydrotherapy is really unique. Basically, they use hot and cold. They do a series of hot, and then they do it with a cold. It's a lot of circulation, get the hot going, and then the cold brings your body down. They do it on your chest and your back. And they use what they call, I would call it a TENS machine, or it's a stimulator, to help stimulate certain muscles. For me, my stomach and my liver, to get it going, to get any toxins out of my body. So I was doing that 3 times a week.
So it's like a machine, or is it?
It's like it's a TENS machine.
Hydrotherapy, think of
yeah,
water.
they use hot packs and cold packs, and then at the same time they take a stimulator. It's like pads, electropads, put it on parts of your body, and it's supposed to stimulate your organs to function. Like my liver, it helps detox and get my liver going.
Because that's what they say is a big cause of eczema.
Yeah.
Yes, besides my immune system, which when she did the testing came back, I was severe in several mineral deficiencies and high in some actual metals. And looking at everything, she realized treating me from the inside has made a huge difference.
Right.
That's great. So any side effects?
No, absolutely not. Only amazing, progress. Even my husband and my daughter are just amazed every time they see me. And every time I go into his office, they're like, wow, even better and better. So,
any other benefits besides clearing up of eczema that you've noticed, like unexpectedly?
Really, a lot more relaxation. I feel comfortable. I trust Dr. Workin. And it's funny, I'll never forget one time I was getting my hydrotherapy, and she actually just sat on the floor with me. She was on the floor, I was on the table, and she sat there and we talked. And she listened to me and asked me any other thing going on. Just listening to me, I just felt there every time leaving that, wow, someone heard me and listened to me. And I think about that when at home and having stress or going through a time, and it's helped bring some closure and peace into my life.
Wow, fabulous.
So, yeah.
That's great.
Thank you for sharing.
Thank you very much.
I've met her, and I know she does do that. She does listen. It's really great.
I think
Do you
she's
have
been a guest on your show, hasn't she?
Yes, she has. Mm-hmm. Is there anything you'd like to add about
Well, I'm sitting here
this
looking
particular
at
case?
I'm just thinking. I'm looking at Roberta just glowing.
Yeah, and I
her
don't even
skin
see any
glowing.
signs of eczema
And
that she even ever had any.
It would be hard for anybody listening or watching to imagine how bad the eczema was. She was covered from head to toe
Wow.
with, what some people would call angry, red, inflamed lesions. Her entire body was covered, and That was our starting point, or Dr. Workin's starting point. And this is interesting. You know, one of the things we know in natural medicine, when you treat somebody from the inside out, see, the skin is just the covering. If you have a skin problem, the skin's not sick, the patient is sick.
Right.
So you treat the whole person. And one of the things that we know through observation for 2,000 years is the body heals according to in a specific way and according to a specific pattern, which is from the inside out and from the top down. And hers was a textbook case. As her skin started to heal, it started first to heal on her face and then her torso, and it was the rash, Roberta will verify, the eczema just moved right down her body as if somebody was pulling a body glove off of her.
Wow. That's amazing.
That's really great. Okay. Our next guest is Caitlin McDermott.
Hi, how are you?
Hi. Nice to have you here.
Thank you. It's great to be here.
Tell us your story.
Oh, I've got a great story. I mean, I was very, very sick when I first met Dr. Sensenig. I've never been that sick in my adult life. I was permanently closed. I had basically my whole side of my face was swollen out to here. I had Bell's palsy. They thought I had herpes of the right eye. I had an inflamed nerve. I had been bedridden for about a month. I've usually been a very energetic person, and I had moved in with my parents because of the intense pain. I was sleeping most of the day.
Wow.
I had been through 3 medical doctors and 2 specialists. Basically, I could smell the antibiotics coming out of my skin. I was so toxic.
Oh, wow.
And I'll never forget the day because my sister finally heard that I was very, very sick and I wasn't getting better. I was actually getting much worse. And she said that a friend of hers from London had heard of this miracle worker in Hamden, a naturopath, and I was just ready for anything. I was so broken down. And I walked in, and I left, I think, almost 5 hours later. And
wow, that's a long
Dr.
visit.
Sensenig, yeah, talk about a difference. Because usually I would go in, they'd give me another script or do something. And Dr. Sensenig and the 2 other doctors, I mean, I've never felt so much love, so much concern. Looking at all these, now that I understand what you do, looking at all these crazy symptoms, but just looking at them and really looking for what was wrong. And, I mean, I couldn't even breathe properly. I couldn't walk without huffing and puffing. I was so swollen. Everything was reacting. Months later now, I'm on a very strict protocol with my diet, with supplements. Sorry.
What were you actually diagnosed with?
They think what happened was I had a severe viral infection that was misdiagnosed as a sinus infection. I was put on like 4,000 milligrams per week of Cipro, then this and then that. And then I know you're talking about the burning house. My foundation was just, I was after a full earthquake. Everything just started to not work properly. And I was just getting toxic. And so all these kind of, incrementally, everything started to fall apart. Again, I've never had so much energy. I talk about top down. I mean, it was textbook. As they were kind of detoxifying me, suddenly I'd break out in a rash, and then that would go away, and then I'd break out in another rash. My whole body was kind of letting go of all these toxins. And now my eyes are bright. I sleep like a baby. I've never been this, knock on wood, healthy for so long. But also the loving attention that you get at Natural Health Associates, it's just mind-boggling. It's so.
Yeah, we want to.
It's the anti.
Yeah.
I know.
It's the anti-experience of anything I've ever had by going to a conventional doctor. I can't say that.
No.
It's not. It's
Naturopathic
good.
doctors, yes.
Yeah, we're
It's just
talking
good.
about your experience
Yeah,
It's very
with
good.
naturopathic medicine.
Medicine,
yeah.
right.
And so this
different naturopathic
and hopefully
doctors.
this will go.
Personally, it was great for me.
Good.
Thanks.
Okay.
Fabulous.
Do you have anything to say?
Well, I'm thinking of a couple of things, but one is, can you tell us what your expectation or what's the word I want? Hesitations might have been in coming in?
Yeah.
In going to a naturopathic physician.
I would, please excuse me, but I was like, oh, I'm not going to go to a quack. I'm not going to go to I've never been crunchy. I've never taken more than a, multivitamin. I don't want to go gluten-free. I don't go to health food stores. That's not me. I'll just solve everything by taking a 3-mile run and trying to, eat less carbs. Just kind of an intelligent person, but the way I treated it and fed my body was the most unintelligent way possible. And everything that they did, from listening to me, really talking to me. I mean, the amount of back and forth in and out of the rooms. And then one of the doctors came and felt my pulse and said, "You've been dealing with grief.
Yeah.
You've had significant loss."
Pulse
and then
can
I
tell
just
a
started
lot,
to
yeah.
cry because, of course, that was true too.
Yeah.
But yeah, there were. To tell you the truth, the only reason I went is I didn't have any alternatives left.
You were at the last straw.
I was, and I was so.
Which
I
is
was,
how a lot of people.
I was going to the
make a
local
change.
medical walk-in clinic because that's all I could afford. I wanted to do no more than the $20 copay. And so everything that you're saying about, it really, if you're not looking for what's really underlying those symptoms, you really can hurt yourself that much more.
Okay.
Thank you for sharing.
Sure.
So, can I make a couple of comments?
Yeah.
One thing is that Caitlin just said that she was doing the wrong thing with her diet. But the problem is that you're not told any better.
Right. This is
One of the things
message you're getting.
that we hear often from conventional medicine is it doesn't matter what you eat. I recently heard this secondhand, so I can't verify it without doing some research, that there was a very well-known obstetrician at a conference in Phoenix who told the audience that it doesn't matter what a pregnant woman eats because it doesn't affect the fetus. And that's an extreme example. But the idea, we have grown up in this country with a system supposedly directed at our health, the healthcare system, which is actually a disease care system, which tells us that it doesn't matter what you eat as long as you get 3 square meals a day, whatever that is, right? So the average person is trying to negotiate this, what should I eat, what should I not eat, because of what they hear on TV and read in popular magazines, or what's the fad of the month or the week or the year from their friends, and so on and so forth. What you eat does affect your health, but it's different for every person, and it has to be based on that person's biochemical makeup and their physiology and their genetic background and so on and so forth. The other thing that's really important about Caitlin's story is Caitlin, as she said, she was never crunchy, she didn't know what granola was or whatever we're talking about here. She didn't come in the door to a naturopathic practice, whether it was mine or any others, because she was sort of philosophically attracted to the idea,
Right.
or because there was something about the philosophy that captured her imagination.
It was
Nothing like
desperation,
that.
pure
She
desperation.
came because, like so many hundreds of thousands of other people, she said in her own words, she had no alternative. Now, we live in a part of the country where we have some of the best hospitals and the best doctors on the medical side, and yet there are hundreds of thousands of people who can't be helped by that system.
Yeah.
So they do call us quacks. We sometimes call ourselves quacks. I've lived with that all my life. But who are the quacks? When and if you measure what you're doing by the outcome, not by whether it was proven in a clinical trial somewhere.
That's right. It's absolutely right. People should stop and think about that. That's really right.
And the proof's in the pudding. I guess you learned a few things.
Absolutely.
So, okay, our next guest is Larry Batsa. And your experience with naturopathic medicine and your symptoms and what you had and so forth?
Well, for me, it was all about quality of life. And for a couple of years, I was trying to make myself better. I was not impressed with the medical profession because they weren't giving me any help. I had difficulty with digestive. I had difficulty with foggy brain, not being able to concentrate and focus. The fatigue was unbelievable. I was extremely tired with a stressful job and kind of thing like that. So by the middle of the day, I was totally wiped out, and I kept pushing through. What I didn't realize was the things that I was trying to do myself by taking certain supplements and vitamins some of those hurt me, and I ended up with a problem with kidney stones and just got myself into trouble.
That's
and
an
I realized
important point, and
that
that's why
right.
it's so we
Yeah, I
stress
tried
on
to
the
do
show
it.
that you really need guidance. You really need guidance.
You can't
I-
just go there and do
That's
it
right.
yourself.
Willy-nilly, I'll take
No.
this,
Yeah.
I'll take that,
Yeah.
or what somebody else tells
You
you.
need the
worked for
guidance
them.
from a naturopathic doctor.
I came to that conclusion, and I just came into the naturopathic office and threw myself at Dr. Sensenig's office and said, here I am, there's all these things going wrong with me, and the quality of life is, pretty bad, and I really need to do something about it. I've tried to solve the problem myself, and it's not working. And so I was very, very impressed with the process that I was put through, the opportunity to be examined in a way that I was thoroughly looked at inside, and everything was determined as to what was happening to me. And that allowed for a plan to go ahead and mend those things that were wrong. I found out through that process that my white blood count was down, my immunity system was being compromised, and there was a bunch of things that were not working right. And as far as my digestion system, they came up with a complete plan of food and things that I could eat. I found out about 21 things that I was sensitive to that were stressing my body and causing problems for me. And I immediately began to follow as quickly as I could a regimen and looking for the proper diet, food, supplements. I had to give up pasta, I had to give up things like pineapple and walnuts and things that I thought were helping me that were not. And so once I got on a regimen of doing this, and it's been just about a year now, my energy level has come right back up. My thought process and thinking and concentration is very clear and sharp. A lot more than it's been all my life. And I sent my wife in, and she ended up getting her energy level back up. She said, I feel 10 years younger. And I have an 89-year-old mother who has been visited into the naturopathic as well. And she came back to me about 2 weeks ago, and she says, I have more energy, because she's been getting herself acclimated to the process as well. But I just have to say that I really believe that looking at the whole person is so significantly important. And when I realized that is, what was going to make a difference in my life, I embraced it. I can remember years ago when we were growing up, doctors used to visit the houses, and they used to see you for everything, not just one thing.
Right.
And we got away from that.
Well, they knew you.
They kind of knew you, and
more.
that kind of worked like that, but it wasn't as thorough, and it wasn't as cohesive as the process that I've experienced here. And I'm grateful. I have sent a lot of my friends and family and colleagues this way
To
to
naturopathic
understand
doctors,
naturopathic medicine.
Right. That's great. That's really, really great. So you would recommend it to everyone.
I have.
Okay. This is what we want the point to get across by having these people tell their stories, that it does work. And you can save yourself a lot of side effects, a lot of trouble, a lot of grief, a lot of more getting other kinds of illnesses from this medicine. Medicine has a place. We're not saying you can't take any. There's a place for it in certain instances. There really is.
I think
But-
Caitlin has
one
another
thing
comment
too,
too.
and
Sure.
you save a lot of money on medicine.
There
I
you
mean,
go.
When I was on all those antibiotics, I was spending hundreds of dollars on antibiotics. And now, as you were saying, doing a proper diet, not only am I saving money on all this stuff that I shouldn't be eating anyway, but I'm saving so much money by not having to go on any of these crazy drugs that they want you to.
Yeah.
And to regain to regain your health and to avoid all that stuff, and to go, even now I impart this on my sons, and then they eat what I eat, and their health has gone through the moon. It does at the end it saves a lot of money.
That's good. That's a really good
Fewer
point.
chronic problems to follow you throughout life, where that money just keeps draining out
Without a doubt.
over the long run.
More people just realize that it's so much to do with the diet, doesn't it? With a lot of people, so much.
Yeah, two comments. Can I come back to the diet
Sure.
in a minute? I mean, this point that Caitlin is making is a very important one. You think about, some people complain about the cost because there are more, generally speaking, I think with a competent naturopathic doctor, there's going to be more visits up front.
Right.
Until you get things turned around and straightened out. For example, Roberta mentioned doing the hydrotherapy for the eczema. Well, that's a more aggressive approach than you're going to see when you walk into a dermatologist and get hydrocortisone. It costs her more time and more visits than it would if you just did the shortcut where you turn off the alarm. However, the long-range benefit of that, having her health back, not just with respect to the eczema, but with respect to her overall health and well-being, that minimizes her healthcare expenditures, we'd like to think, for the rest of her life.
Right.
Right?
Right.
Or you take Monique's example of a child who has had asthma and eczema and chronic otitis. Now, he occasionally is seen for some ear infections, and it was just recently the case again. But he's not using asthma medication. He's not being treated for his eczema anymore. Look at the cost savings on those two things alone. And this is just a youngster. Think of what this is going to be over his lifetime. Diet is very important, to switch gears and come to that question, Rosemary. That's what we're made out of. The stuff you're putting in your mouth is going into the body to be used as building blocks or functional molecules in the body. This is fats and carbohydrates, vitamins and minerals, fatty acids. This is the stuff you're made out of. Most people, everybody's heard this. Most people feed their pets better than they feed themselves. Most people treat their car on a better maintenance schedule than they treat their own body, and so on. But we have to emphasize that these quick fix diets and these quick fix take this for this problem, everybody is an individual and their biochemistry is completely different. One of the things that Larry said that I know some listeners keyed into is he used the word, I gave up. I had to give up. People often say, you mean I have to give up this or I have to give up that? I mean, especially in this part of the country, who wants to give up pasta or pizza?
I know, my heart dropped when I heard that.
And so, but there's a bright spot, and the bright spot is once you correct the problem, you're back to having a more or less a normal life.
You can have it back.
With my daughter. She had a serious autoimmune problem when she was very young, and we had to eliminate so much. But what was said to have been a lifelong problem that she would never be healed from was healed, and now she can eat other foods in moderation. Like, we don't want it to get out of hand again, but
well, you want to do that all the time.
Right.
Everything should be done in moderation.
And Larry wants to add something to that, but I just want to say quickly, giving up, you're not giving up anything, you're gaining.
You're gaining.
Why would you not let go of something that's holding you back or something that's ruining your life? Right? So letting go of the pasta temporarily, to use his example, is a trade-off for a better life, clearer thinking, better digestion.
Absolutely.
You want to add something?
Yeah, I do. When the diet thing came down, being of Italian descent,
really?
Giving up pasta was like shooting a hole in the
even
middle
your
of my
last
stomach.
name rhymes with it, pasta.
At any rate, what I wanted to say was my wife was very diligent about pursuing substitutes for this, and rice pasta with sauce. You can't tell the difference.
We can have that.
You cannot
that's what
tell.
I eat.
I got to tell you that she has learned to do some things. It's all about what you want to do and what you want to invest. And I think that we've made an investment. I don't really miss the pasta because I have rice pasta.
Yeah.
And there are other things that she substituted for. So I just wanted to encourage viewers to say that if you want to do it, you can really do it. You just have to get on board. It's a commitment to your well-being and your quality of life. So that's important to do.
Well, not only that, when you do that, you reach outside the box. Healing outside the box, you learn that there's more to life than pasta and tomato sauce.
Well, to me, I
set up a little variety in life.
I'm allergic to wheat and soy, as you know. Okay, and I've been eating rice pasta for a long time, and I consider it pasta. I don't miss a thing. I have my sauce and my pasta, and I love it. So, when you say pasta, you mean the wheat pasta that you might get in the restaurant. Yeah, semolina. But the other one is
Italian
certain brands.
So we know.
Certain brands of rice pasta is excellent.
Well, the point that he made, pasta is rarely eaten by itself. When you put some kind of sauce on it or cook it with something else, you can't really tell one from the other.
And things have improved. I just feel like because there's more and more people making these changes, and I do honestly feel hopeful because there are people becoming enlightened and making some changes, that the products are getting better out there too.
Yeah.
They are really improving. So
I remember years ago,
Yeah.
you couldn't find I had a health food store. You couldn't find hardly anything for that.
Right.
But now, this is wonderful. Cookies, cakes, pies, everything.
The non-gluten.
Yeah, it's gluten-free. Yeah.
Yeah.
More and more and more because more people are realizing they have these allergies.
Well, and the proof of that is what's happening in the commercial supermarkets now. You don't have to go to a health food store to find healthy food.
Right.
All the major supermarket chains here in New England have in the last 6 months, have new departments and have remodeled to put in a whole section that used to be called health food.
Right.
And that can only be because the public is demanding better food and more choices.
People power. I've always say people power. We have the power to make the changes that we need. We just have to ask.
And let your money follow those choices. You know,
That's right.
Yeah, vote with
you don't
your
need
dollars.
to make you don't need to make big charitable contributions to your organizations. Just spend your money on things that support organics, and you could do it that way.
That's right. Stick together. Stick together. So, how do you know when a patient's getting well?
That sounds like a complicated question, but it's actually very, very simple.
All right, we have 2 minutes for you to tell us this.
The old writers in Health and Disease from Hippocrates forward would tell you that illness is a disturbance in the function of the body. Let's just say it's a disturbance in the force. And something's out of whack, something's out of balance, and the goal of medicine should be to restore the balance, not to treat the symptom, restore the balance. And when you restore order, order is orderly, right? So the changes that occur in an individual, which is an ecosystem, right? When order is restored to the ecosystem, it's restored in an orderly way, and the symptoms that a person has will change according to a specific pattern. We already alluded from the top down, but it's also from the inside out and from the top down. So an example might be...
Yeah, go ahead.
An example might be the rash that we've talked about in several cases that's moving from the top down.
Right.
But a digestive problem that's well treated may end up as eczema again, particularly if that patient had eczema.
That's important to note, because people might panic and think that they're getting worse.
And here's
but
exactly what we've been talking about all night.
Yeah.
If you have the eczema and it's treated only topically, the burning building is still burning and it goes deeper.
Right.
When you reverse that process, it comes back
coming
again.
out, yeah.
But it comes back again because health is being restored.
That's
how
great.
we know.
I remember you
quite
telling me
simple.
that a long time ago. We have to go this way. It took us so long to get there, and now we have to come back through all the symptoms
You have to pass. If you go from here to there on a trip, you have to pass the same milestones when you come back. There's no way around it. You can't get there from here. Nothing goes away. We live in the world of instant gratification. You can't make a problem in any area of your life go away the way people expect medical doctors to make your physical problems go away.
That's right. On that note,
Good
folks, we're going to close the show, and we're going to give the information. Okay, to reach our guests with any questions that you might have, or to learn more about this topic tonight, please visit just call Dr. James Sensenig at 203-230-2222.
That is wrong.
It is? What is it?
It's 203-230-2200. 2200.
Okay, we got that. All right.
2200.
Or you can reach him if you want with your questions to www.naturalhealthconnecticut.com. Okay, you got that number right, I hope.
230-2200, just for you viewers again.
Oh, there we go. I want to call that other number and see who's there.
And we'll put our information up there too.
To reach us with any questions that you might have, or to see a list of our past shows, and to find the days and times our shows will be playing in your area, please call us or go to our websites. And you can reach us at, for me, it's area code 203-627-7966.
And my number is 203-232-3405.
And there, our websites are right there for that information, so you can look up the show schedules and what towns they'll be playing in, and when at the times in your areas. Okay, now we have our quote for tonight.
You got that, Rose?
Yeah. Okay. Here we go. As every storm cleanses the earth and the air, so does every storm in our life cleanse us from that which is no longer needed. The stronger the storm, the greater the love that blows through us. I want to thank you, Dr. Sensenig, for coming. It was wonderful as usual.
Thank you.
I want to thank all our guests
Thank
for
you very
telling
much.
their stories. And we're so happy that you came to do this. Thank you.
And thanks to our viewers. Come back again.
Always know you are the vision